Hi, Dr. Schultz here. I want to talk today about knee issues. So first of all, let's talk about the bones that make up the knee. First, you have the femur here, and then you have the tibia, and that makes up the knee joint, okay? And I'll show you this just in the anatomy book here. So here's a knee x-ray. This is your knee joint, and that joint must be even all the way across. The femur right here can't be twisted or turned one way. Okay, this joint has to be even across for you not to have any abnormal wear and tear on the knee joint and for it to work properly. Now, sometimes it's not actually a knee issue, even though you feel it in your knee. Sometimes it's a pelvis issue because the pelvis is twisted, and when the pelvis twists, so does the femur twist, and it puts unnecessary stress on the knee joint. So as a chiropractor, I will check both the pelvis and the knee. Sometimes it even can be a dropped arch in the foot causing knee issues. But let's talk about the knee. So what I do for the knee is I'll do an assessment on the knee, check for any wedging in the joint, make sure it's moving properly, check to see if the femur is rotated one way or the other, check to see if the tibia is rotated one way or the other. And we make a small correction in that to make sure the joint is even and there's no wedging or twisting in the knee joint itself. And that a lot of times can fix so many knee issues. And I know there's so many people out there worried about their knees, having knee issues, and they have misalignments in their knees, which are just wearing out the knee joints further. They're grinding down the joints because they're not aligned right. Now, even for athletes and young athletes, aligning this knee joint is super important for not getting things like ACL tears, PCL tears, and exposing yourself to those kind of injuries. So it's always a great idea if you're having any knee issues or any pelvis issues to come in and get checked and make sure everything is aligned so your body can work at its best.